EEG records brain activity through small scale electrodes. It was invented in 1925. Initially, paper and a stylus were used. Now, computer is being used to record EEG. Mainly three montages are used. Most commonly used montages are monopolar, bipolar, referential. Bipolar is either longitudinal or transverse. Bipolar longitudinal montage. Left side. Measurement of duration. Distance between two main lines is equal to 1 second, that is 1000 millisecond. Waves are counted in this duration. Here it is 11 Hz. Amplitude is measured in millimeter. Here it is 1 millimeter is equal to 10 microvolt sensitivity. Here the waves are of alpha range posteriorly predominant. Waves are described on the basis of predominance, configuration, symmetry, synchrony, frequency, amplitude, and reactivity to eye opening, eye closure, limb movement, tactile exposure, sound, etc. There are four types of background waves: delta, theta, alpha, and beta. Delta waves are normally found in deep sleep and hyperventilation. Its frequency is 0.5 to 4 Hz, usually frontocentral in position. Amplitude is variable, configuration is variable, it is symmetrical and synchronous, it is reactive to stimulus. Abnormal delta waves are CDA, LADA, PDA, FILDA, OLDA, RDA. Delta waves are normally found in stage 2 sleep with the frequency of 5 to 7 Hz, symmetrical and synchronous, reactivity present. Abnormal theta waves are focal, intermittent burst of theta activity. It is the normal background activity in the relaxed persons with eye closed above 8 years of age. Frequency is 8 to 13 Hz, amplitude 50 to 100 microvolt. Right is more than left. Posterior predominance with frontal attenuation, reactivity present, symmetrical and synchronous. Abnormal alpha range are no reactivity and no attenuation, that is found in alpha coma. It's a normal activity, non-reduction individual with frequency of 14 to 25 Hz, amplitude of 25 to 35 microvolts, symmetrical and synchronous with reactivity predominantly frontal. Abnormal is universal, non-reactive beta wave found in beta coma. Activating procedures are used to enhance the capture. Used are HV, photic, and sleep deprivation. Photic can cause photomyogenic, that is posterior activity coinciding with the photic stimulus, and the photoparoxysmal, that is PPR. It is non-coinciding, a spike and wave pattern posteriorly present which may be generalized. Artifacts may be present in the EEG, which can be cardiac, electrode, electrical, muscle, ocular, or bridge artifacts. These should not be interpreted as epileptic activity. Normal awake record in persons above 8 years of age relaxed with eye closed shows predominantly alpha waves activity, posteriorly predominant, symmetrical and synchronous with amplitude of 70 to 100 microvolts, reactive to eye movements, no epileptiform discharges seen, HV photic, uneventful, and small sharp spikes may be present in frontotemporal region in some persons. Normal sleep records in a person above 2 years of age. Stage 1, loss of alpha pattern. Stage 2 shows slowing of background activity with few other important activities may be present. One important activity is K complex, which is frontocentral polyphasic waves of 500 or more millisecond durations, and this may or may not be followed by sleep spindles. Sleep spindles are centroparietal 14 Hz activity, which is spindle shaped, and symmetry and synchrony is maintained. Post positive occipital sharp transients and wickets, mid-temporal random delta activity. These are all normal activity and should not be confused with the epileptiform activities. Identifying epileptiform discharges. visible change in the background, and the clear-cut onset before the formation. The formation is polyphasic high amplitude activity which is followed by clear-cut offset as after coming slow waves. There are some exceptions. The epileptiform activity may remain focal or may become generalized. Common types of epileptiform discharges are G-plate, biplate, RDA, OIRDA, FIRDA, CAE, Otahara syndrome, BCECTS, Rolandic seizures, CJD, and hypsarrhythmia. EEG grading of encephalopathy. Grade 1 predominantly alpha with minimal theta wave activity. Grade 2 predominantly theta with minimal alpha wave activity. Grade 3 continuous delta activity. Grade 4 low amplitude delta activity with burst suppression pattern. Grade 5 electrocerebral inactivity or electrocerebral silence. A 30 minutes record is taken at the sensitivity of 2 microvolt. There is no activity over 2 microvolt, and even on noxious stimulus there is no activity over 2 microvolt seen. EEG finding of coma. There may be findings of encephalopathy as described, or findings of status epilepticus or non-convulsive status epilepticus, or alpha coma, or beta coma, or spindle coma, or triphasic coma. This video is only an introduction of EEG. Proper training and teaching is required for complete evaluation and interpretation of EEG. Thank you very much.